Imagine a woman, she finds something in her breast. It could be a discharge from her nipple, could be a fold or a thickening in her skin, or a hard lump that wasn't there last month. She does what normally most women do. She walks into her gynecologist clinic, whom she knows very well, she trusts, and she examines her carefully and then says, let's get a scan done, and refers her to a scan center that is nearby, maybe an ultrasound scan, maybe a mammogram, whatever that is locally available. She goes to the scan center and she sits in the waiting room with men waiting for CT chests, abdomens, with children with fractured arms and elbows waiting for x-rays, multitude of things. And the technologist who does her mammogram must have dealt with all the other scans and procedures as well. And the radiologist who's reading those mammograms would have reported from head to toe. And she's asked to come back to pick up the result the next day. She goes to her gynecologist with the report, and then the gynecologist goes through the reports carefully once again. But she is not a breast specialist. And if she needs a biopsy, she has to go to another center, another place, another doctor, another weight, and another report. And so somewhere along this winding journey, it could be competent. People are kind, but somewhere along this winding journey, the expertise that should have been concentrated on breast, but where concentration matters the most, gets thinned out through the whole body, diluted. Imagine another picture. She walks into a purpose-built center where the technology available is the best that can be found in the current times. And the mammographer who's doing the mammogram with utmost sensitivity and gentle reassurance has made breast imaging her career. And the radiologist reporting those mammograms is trained so well that her eyes pick up the subtlest of findings. And if she needs a biopsy, it is then there, the same day, in the same visit. And the pathologist who's reading the slides has made breast diagnosis her job. And if she needs eventually surgery, the surgeon who's operating is a breast specialist. Same patient, same lump, but two different experiences. Narrow but deep. That is what I chose to do. I chose to build the second model, and that is where my journey started. I must tell you something today which I don't talk about much in public now. 20 years ago, I actually went to the UK wanting to be a pediatric surgeon. That was the plan. But I was going through a surgical rotation, and one of the surgeons that I worked with was a breast surgeon. She actually did more breast surgeries than other general surgeries. At that point in time, one afternoon outpatient clinic, when I walked into the room to examine a lady with a breast lump, when I walked in, I could see that sense of relief on her face, that a woman is coming to examine her. I understood something that day, that if a woman, a Western lady, finds comfort in a woman surgeon examining her, then so should our Indian woman feel. And that's when I thought I could make a difference by doing breast surgery. And I started training to do breast surgery. And when I decided to come back to India, because our women, actually out of fear, out of modesty, out of the slow social conditioning, she's taught to believe that her body is not hers to speak for. And they don't reach the surgeon at all, sometimes so late that the disease is so advanced. And this is where I thought I can make a difference. And I came back. When I came back, I was advised against narrowing down only to breast. Women, I was told, normally reach out to women surgeons for two problems, breast and bottoms. B&B surgeons, the male colleagues, would make fun of us. And I considered it. It was not a bad advice. It was reasonable. I thought about it. But if you divide your attention between two organs, you cannot dive deep into one to specialize into one. At that point, I had to make a tough choice. I narrowed down. I narrowed down to do only breast. I also realized that it requires a lot of training. And not just being a breast surgeon is not good enough. Because for doing good breast work, you need good imaging. You need good pathology. Without good imaging, without the precision of breast imaging, and without the precision of breast pathology, breast surgery is just not good enough. And that is when I invested. When I invested, we got the first digital mammography machine in 2007. And with the prone table stereotactic biopsy, This was first of its kind in India, first in Chennai, definitely. Not that we wanted to be the first. It was not even, it didn't even make any commercial sense. But we did it because the work that we wanted to do demanded those tools, and it simply didn't exist then. So with that, we were able to start that one-stop breast center concept. So where consultation, imaging, the mammograms, the ultrasound scans, the contrast studies, the biopsies, the various types of biopsies, the pre-surgical counseling, pathology, surgery, everything happens under one roof. The same team, all women team, and that made a difference. That definitely made a difference. And with 20 years behind me now, I can say confidently that sometimes changes in medicine need not always be a new drug, a new machine, a new scanner, or a new robot. Some changes are quieter. It's about being organ specific. It's about defining your boundaries. It's about defining your specialty. How deep are you willing to go? That decision, actually waiting for it to train and to practice whatever you've learned over a period of time against all the resistance, it took a lot of time. Patience is what we needed, because that concept didn't exist then. Because the warning to restrict, not to restrict only to breast and to open the scope wider to do other things as well, was based on the assumption that narrow careers are smaller careers. But if you divide your attention between many things, you don't dive deep enough to make it your special career. So that is where the depth matters. To a patient, that depth matters. And that's where we made a difference. Together as a team, there are 8 of us now in the team, and we do the best possible outcome for that patient to go home with a breast preserved, not just for cure, but for aesthetics as well. So I can tell you today, any field, any specialty that you do, it's easy to be a jack of all trades, but we have to be the master of one. That is where we make a difference. And today I can say the most promising thing is a lot of young Indian women doctors are choosing breast as a specialty. Not just surgery, they're choosing radiology, they're choosing pathology. And there's a whole lot of dedicated team of doctors training in specialist dedicated breast units, and they go on to their cities to develop this one-stop model. And this model is narrow but deep, and it's built to last. So our women deserve it. They've always deserved it, and finally, we're doing it around her, centered for her. Thank you.